Whether it's to get a boost of caffeine or just to go along with a hamburger, soda is the drink of choice for millions. But is the sweet beverage really worth ruining your teeth? We've got Dr. Tomase joining us with a warning for some people this morning. Good morning.
Good morning, Crystal. Thank you for being here.
So glad you could come. So, you know, one thing that I think a lot of people don't understand is for sodas, it's okay every once in a while, but really, in general, you should just avoid it, right?
Exactly. As a dentist, that's what we recommend. Especially what happens is people drink diet soda and they'll say, well, I'm drinking diet soda. It doesn't affect my teeth, but actually it really does.
Yeah, that's right. And how much soda are we talking before you actually see an impact on your teeth?
I just read a study where if you drink at least 3 cans of Coke or pop soda a day, diet or non-regular, it causes 62% more decay than somebody who just drinks water.
62%.
Right.
That's a scary statistic, especially coming from a soda drinker myself.
Yeah, exactly.
So I see you've got an example for us of Diet Coke. Some people say that certain sodas are actually better for you than others.
Right. As a dentist, we don't recommend anybody drinking soda, but what happens with the Diet Coke, it has phosphoric acid, citric acid in it, and that's what really breaks down the teeth. So once you drink the pop, you're bathing your teeth in that acid, and it starts breaking down immediately, and it lasts about 20 minutes after that. That's what people don't realize. So, I mean, the effects are long-lasting afterwards.
And one way that kind of curb that effect is chewing Trident afterward, right?
Absolutely.
I've heard it's a myth, so you're saying this can actually have an impact.
Any gum, especially with Trident or sugar-free gum, is great because it gets the saliva flowing, and you want to get saliva flowing to wash away the bacteria and acid. And the other thing you can do right away is rinse with water. That's why I got the bottle of water up here. Really helps extremely well. Chewing gum, rinsing with water, and then brushing afterwards. After a few minutes after that helps too.
So if people decide to wait hours out, by then it's too late, right? You need to do it right afterward.
And the worst thing you do is if we get them more if people sip it all day long, because that keeps the acid in the mouth low the whole time. So if you're going to drink your Coke, whatever, drink it at lunch, dinner, but don't keep sipping it all day long.
Very good tips.
That's the big thing.
And for those of us who are seeing any damage from drinking sodas, is there any way to reverse that?
Yeah. Biggest key is to seeing your dentist. If you see your dentist regularly, we're trained to spot damage to a tooth right when it happens. So you may look in your mouth and not see any damage, but we look in it and we see damage already. And the trouble with teeth is that it's not like spraining your ankle where it hurts and you go, I got to see my doctor. With teeth, they don't hurt until it's too late. So you really want to get in there regularly every 6 months and keep your dental visits.
Yeah, and we have some pictures actually scrolling now showing some of the damage from things like soda.
Exactly, yeah.
And you have some examples for us as well with different mouthwashes that can help. Is this something that can reverse damage, or is this something that's more of a preventative method?
This is more preventative at first to use it. Now, if we see you in the office and we see some damage, we can give fluoride treatments, a little more heavy duty, and we can also recommend other products to use too. But this at least is a good start to slow it down.
Okay, so good for daily use.
Absolutely.
Well, one thing that we know is a problem for a lot of Americans is a lack of dental insurance.
Exactly.
Why do you think so many people don't have it?
I think right now it's companies are cutting back and medical costs are so high that they'll cut out the dental insurance. Right now I think 42% of Americans have dental insurance. So it's really, it's frustrating to them because they feel they can't afford to go see the dentist. And actually they can.
Yeah, and your office is offering something called a quality dental plan.
Yes. Quality dental plan is really a neat thing because what happens with quality dental plan, you come to us and you're buying a membership, basically like a Costco membership, and it's a reduced fee saving plan. And so when you come to us and that reduced fee, you're going to get 2 cleanings a year, x-rays, exams, fluoride, and for a certain price. And after that, the biggest thing is we give 15% discount to any dental procedures after that. So
Sounds
it really
like a
works
great
well.
deal.
Oh, it is. People love it. Absolutely love it. It's a no-brainer, they say.
Well, we are going to link people to your information on our website, ToledoNewsNow.com. Thanks so much for coming in.
Thank you, Crystal, for having me.